So today is also World Cancer Day, and to honor the 17 million cancer survivors all across the U.S., the CDC is launching what they're calling the Talk to Someone tool. And this is really the goal here is to help with recurrence.
That's right. To tell us more is the director of the CDC's Division of Cancer Prevention and Control, Dr. Lisa Richardson, and Rebecca Schmitz, a cancer survivor herself. I want to thank you both for being here. We really appreciate it. Doctor, let's start with you. How many cancer survivors are there in the United States right now?
So there are about 17 million cancer survivors, and we anticipate that that will only increase over time as the population increases, the age of the population increases.
And talk a little bit about how those lifestyle choices with treatment and the recurrence rates, what do they have to do with one another? Where's the connection there?
So the connection is when the risk factor that caused the cancer, such as smoking, can cause several cancers. If people continue those behaviors, they will get a cancer again, a new one, or that the cancer will come back. And so our Talk to Someone simulation tool is really to help people work through those behaviors and try to figure out how to live healthier after they've had a diagnosis and completed treatment.
Can you tell us a little bit about how the virtual tool actually works and what kind of results you've seen? What's the feedback?
So if you go on our website, cdc.gov/cancer/survivors, you'll find the Talk to Someone tool there. There are 4 topics: tobacco use, alcohol use, physical activity and nutrition, and anxiety. And just click on one of those, and what you do is Linda will pop up and you talk to her. You click on talk and ask a question. She answers the question. So it's a very interactive tool, and people who use her name like I'm using it now, like a real person. So people connect and actually pay attention and learn quite a bit.
And if you don't mind sharing your story as a survivor, Rebecca, why do you believe this tool might be effective and how it could have perhaps helped you?
Sure. Talk to someone is so important. I'm a 2-time thyroid cancer survivor, and I'm so grateful for the incredible treatment I received that has really made it possible for me to live in survivorship. But the greatest challenges for me in my cancer journey really occurred in the months and first year after treatment, where it was really hard for me to see the symptoms I was experiencing. But I had clinical depression. I had anxiety. But, I was just trying to get back to normal and rebuild my life. And I could have really benefited from this resource, Talk to Someone, where I could have any time of day gotten online and had a conversation with Linda, asked her questions. She asked me questions back. It's very interactive. It feels incredibly natural. She's empathetic, and she could have helped me to detect so much sooner that I was really suffering from depression and anxiety, and connected me to resources so much earlier.
There's so much more to it than the diagnosis and then the treatment afterwards. There's a lot that comes along with that kind of diagnosis. Rebecca, doctor, thank you so much for joining us this morning, telling us about this brand new tool. I know you're going to help a lot of people here in our area. If you want some more information about this new Talk to Someone tool, we put a link over on our website as well. You can see it there at WPBF.